HIV can cause swollen lymph nodes, especially during the early stages of the infection. This is because the virus is actively replicating and spreading in the body, triggering an immune response. The lymph nodes, being a key part of the immune system, become enlarged as they try to fight off the virus. During the initial infection phase, which can last a few weeks, people with HIV may experience flu-like symptoms, such as fever, fatigue, sore throat, and swollen lymph nodes. These symptoms are often mistaken for other common illnesses, making it crucial to get tested if you suspect you may have been exposed to HIV. In the chronic stage of HIV, which can last for many years, the virus continues to replicate at lower levels. Lymph node swelling may persist or come and go. Other symptoms during this stage can include persistent fatigue, weight loss, and recurring infections. While HIV can cause swollen lymph nodes, it's important to remember that, many other conditions can cause this symptom too. Swollen lymph nodes are actually a very common sign that your body is fighting something off, and they can be triggered by a wide range of health issues, not just HIV. So if you or someone you know notices swollen lymph nodes, don't jump to conclusions or panic. Instead, let's explore the many possible reasons behind this symptom. Let's take a closer look at some of these conditions. First, there are infections. Infections are actually the most common cause of swollen lymph nodes, and they can be caused by bacteria, viruses, or even fungi. Bacterial infections like strep throat, skin infections, and even dental abscesses can all lead to swollen lymph nodes as your body tries to fight off the invading germs. And ear infections are really common culprits of swollen lymph nodes, especially in children, but adults can get them too. Viral infections such as the flu, mononucleosis, also known as mono, can also cause your lymph nodes to become enlarged and tender. And chickenpox can also cause swelling. Even common colds or respiratory viruses can make your lymph nodes react, especially those in your neck and under your jaw. Then we have autoimmune diseases. These include lupus, rheumatoid arthritis, and Sjogren's syndrome. In these conditions, the immune system mistakenly attacks healthy tissues, which can lead to chronic inflammation. In these cases, the immune system actually attacks the body's own tissues, which can lead to inflammation and, swelling in the lymph nodes. Cancers are another possibility, though less common than infections or autoimmune causes. Certain types of cancer, like lymphoma, can start in the lymph nodes themselves, causing them to grow larger and sometimes feel hard or rubbery. And leukemia, a cancer of the blood and bone marrow, can affect the lymph nodes directly, causing them to swell as abnormal cells build up. Other cancers, such as breast cancer, can spread to nearby lymph nodes as well. This is why doctors often check lymph nodes when diagnosing or staging cancer. And even local skin issues like minor skin irritations, think cuts, insect bites, or small infections, can cause the nearby lymph nodes to swell as your body responds to the irritation or injury. Allergic reactions, whether from food, medication, or environmental triggers, can also cause swelling in the lymph nodes, especially if the reaction is strong or ongoing. It's essential to consult with a doctor to determine the underlying cause of swollen lymph nodes. While most causes are not serious, some do require prompt medical attention. They can perform a physical exam, review your medical history, and ask about any other symptoms you might be experiencing like fever, night sweats, or unexplained weight loss. And if needed, your doctor may order blood tests, imaging, or even a biopsy to make an accurate diagnosis. Remember, swollen lymph nodes are a sign that your body is working hard to protect you, but it's always best to get them checked out if you're unsure, or if they last more than a couple of weeks.